to those points, and these are valid points, and I'm learning, but and I think you mentioned like the fear, overcoming that aspect. So in this whole regard, right? I've been doing the due diligence and doing the research and things of that nature. I'm no scientist by any stretch of imagination, just the ELA teacher, right? So that's as far as my expertise goes. But it's more or less the uncertain, not the uncertainty, but just like, let me put it from this perspective, right? The fact that turnover rate to get this out, right? It makes me feel as a person who lives in America, is just like, we can do this now for this type of thing, which we understand it affected the bottom line globally at a global scale. I get that, but it's just, if we can just put that effort on other issues as well, and beyond the pandemic, it's just bad. It's just I was a bit flummoxed, if you will. Um,
But
but
so,
I'm
okay, let me jump in real quick. See, that part
okay.
of your dilemma is what a lot of us are dealing with. And we have to be able to separate, because the difference this time was everybody was affected. Although
No, I
we might
get
have
that.
been dying at a higher rate, everybody was, so they're like, yo, you're messing with my money. So we
Yeah.
can't play this in-between game anymore of not finding a cure,
Hmm.
and giving the treatment to only those who can afford it. We need to clear this thing up so we can move on. So that little bit of the fear is what we have. A lot of us have to contemplate and really process it and separate it, because this particular situation is different.
No, I agree with that. I acknowledge that. It's just more or less now going beyond that, because there's many people who are not doing that, not making the necessary, taking the necessary steps, doing the research, educating themselves on it, because you don't know what you don't know. And in regards to this, it's just a matter of being comfortable. But I mean, for to be real about it, like my dad, he's up there, and he's at his point where he's seen a lot more so than I have, so he understands more, and he's reluctant to. And I'm just, with this second wave, I'm just not. I don't know. It's just a lot. You know what I mean? I'm not sure if we are ready for it or armored for it, because there's so many people who are not going to take it. So is this going to be just a cycle repeating itself? Because
Well, there's not even enough. Honestly, there's not even enough. I think
yeah,
right now, from what I heard, my job site is going to be one of the sites in DC to administer the vaccine, and I think they said we're going to get around 20,000.
yeah,
DC population is like 10 times that, and then not including the people who work in DC who live in Maryland or Virginia. So that doesn't even touch it.
wow,
But they're starting with the people who are, the frontline workers, everybody who's going to be exposed more likely. So your healthcare workers, your police officers, your firefighters, those paramedics, everybody who's frontline. So the thought is we start with the people who are more apt to be exposed, and then we get kind of into the population slower and slower and slower. But the problem is, as much as the vaccine is going to help at some point, there's going to be in my brain anyway, I don't know what the research is, but I feel like there's going to be such a backlog of people who actually do want the vaccine, that when we actually get to the point where what we have is no longer available, then we're going to end up with a situation where, are they going to rush a second bout without actually having fully seen what the first one has done? That's where I'm getting a little hesitation, because the first time around, nobody's gotten it yet. And I think what's one of these states I just read was going to get like 60,000, and now they just dropped it down to 42,000. So they're lost like 18,000 vaccines just like that. And so the staff of people they were planning on vaccinating has already dropped by 18,000. So you're having already less people getting it than they originally promised. And then you have still people who are like, hey, I'm in this, I'm in this high risk category, and I really want to get this to prevent my exposure. But then obviously you have the people who are not in that high risk category technically, but still are very high risk because of age or where they work. They're not considered frontline workers because maybe they don't work at a hospital, maybe they work at like the local retail store, but that does not mean they're not high risk. So we end up in this situation now where I feel like the supply and demand is going to cause more problems, which unfortunately is inevitable, because there's no possible way to get enough vaccines for all the people that want it in the time frame that they've done it. But the ones that will be out there, I don't doubt the effectiveness. So it's just a matter of time as to how many people are going to get the vaccine, but we're still going to see a lot of deaths until the vaccine is fully integrated into the population. It's become more of a routine thing. So that's part of the issue we're having, is just supply and demand is going to be crazy. It's going to really affect us more than we think.
So as of this morning, Pfizer put out 7 million vaccines, right? And Moderna is supposed to push out about 4 million coming up in the next couple of weeks. But that their struggle right now is about the first dose and the second dosage, right? So that 4 million, out of that, they have to hold back for the people that received that first dosage and is going to need the second dosage. The second problem that they're also facing is storage. These vaccines cannot just be stored in any type of environment. They have to be in a specific temperature level. And some hospitals don't even have the freezer capacity to hold these vaccines. So that's the other challenge that comes along with this vaccination. And they're pushing this vaccine out.
Pfizer only, though. Pfizer only. Moderna vaccines can be in regular freezers.
Okay. So the way that they're pushing it out right now, they're saying is that even if people are getting this vaccine, that 15% protection that it offers, especially that the numbers are rising, that is also the reason that they're pushing this out, because they're anticipating the second wave coming in, and they really want to make sure that when they push this out, that death toll or that great effectiveness that it was having on everybody is not so large in scale that it cripples the economy again and they have to shut everything down again. So that's also what they're trying to prevent with this situation. For me particularly, I feel like any substance in which you put in your body, regardless of history, regardless of the color of my skin, anything that you put in your body, you should question. Just for an individual basis, you should say, well, how is this going to affect me? How has other things affected me in the past? Have I gotten the flu? Have I gotten any of that? And when I took a shot for this, how did that really affect me? I feel like as people, we go to a doctor, we go to a hospital for specific answers to things, when at the end of the day, they work for you. You give them your base information and they trial and error and see what works for you. But I feel like you kind of have to treat yourself sometimes like a baby. You don't just give a baby every single thing the minute they start eating, because you'll never know what specific thing it was that affected them. So if you woke up tomorrow with a headache, or you woke up with something, you don't know specifically what triggered that, because there's so much that was going on, so much you're consuming, so much that you were doing, you're not really paying attention. So I also feel like it's important as an individual, just about your own health, to make sure that you're monitoring yourself and that you're asking the right question and advocating for yourself. So it's okay to have fear, it's okay to have apprehension, but it should be based on an individual fact and base about themselves as well, and not just what somebody tells you. And I think a lot of people's apprehension about this vaccine is not just a time frame, but the sheep mentality of we all should just get it because. And I also feel like if that's not true for you and you have questions and you are apprehensive, you're well within your rights to have those questions for yourself. But I do understand the other side of it as well. Something needs to get done. You know what I mean? Something has to get done. So you still, regardless of what information is out there, regardless of what you feel you have to trust, you got to make that decision for yourself.
I'm gonna try. I have a feeling, because there's so much apprehension, that I'm gonna luck out and get an early access to this thing, and I'm gonna try to make it a public service announcement, because a lot of times people want to see someone that they know, someone that they're comfortable with, someone who's not a celebrity or a politician, who's just a regular dude kicking it and saying, hey, he took it, I trust him, and blah, blah, blah. And that just makes it more real. So if I get the opportunity to get it somewhat early, I'm going to try to document it visually so that I can share that and hopefully just, lessen the fear. But like Tashana just said, please be apprehensive, but also do your research and try to really cut out the say-so and the hearsay, and go read some literature and listen to people. And the politics is one thing, the science is one thing, the economics is another thing. And you got to distinguish between the three in order to make a value decision for yourself.
Okay, so as of right now, based on where the conversation began to where you are now, how much more confident are you guys feeling about this vaccine? I know for me, based on what this conversation started to now, I am feeling a little bit more comfortable with it, just based on the medical advice that has been given. Just you guys sharing information. For me, I feel a little bit more confident about its effectiveness than I did in the beginning.
Well, you know, you guys as a group, I learned a lot of information from each and every one who speaks. However, I find it ironic. I got an email today from my job and also from my manager stating that I was in the selected group, the first group to be given this vaccine. I'm still questionable. Due to my own health circumstances, I feel like I may not be the right individual to take this first. Maybe someone in my age group, my demographic, you know, maybe my type of condition, I would see their reaction and I'd probably go off of that. But as per the conversation, it was very informative. And yes, research is nothing like you knowing for yourself about, you know, any circumstance, any vaccine. But I still don't feel comfortable enough to say, yeah, you know, I'm going to go sit down and get this. And no.
Are you being mandated to take it?
No, they gave an option of not taking it. There was actually 3 options. Not taking it at all. You're not going to take it in the first batch, but you'll participate for the second, or you'll take it immediately, and then they need to know time slots. We're still, you know, once you get the vaccine, you still have to wear the mask, you still have to wear your proper PPE and all of that, but I will not be a part of the first group. Even after this conversation, yes, like I said, I was enlightened with certain things, you know, points that was given. I am not going to participate though.
Okay.
Yeah, so that's my view on.
I think same thing with Cassandra. I'm more informed than I was prior. However, I still have my reservations on it. And then also, I mean, I'm more or less just waiting to see what the first round looks like, and then go from there. And also, like you guys said, assessing it for your own. Much like Roderick, I've never taken a flu shot. Very seldom do I get sick. It's one of those things where possibly I'm one of the small, you know, group that can not take it for an extended period of time before I can. It's just a lot of nerves with this, man. It's just a lot. You know what I mean? Like, I think the mental effect that it's having on the community, I think that's more or less what I'm speaking to, because I teach that. And I know I always go on my educational kick when I get on here, but it's real, because like the mental breakdown that it's having on our community, and it's stemming from, you know, the worry from the parents, and it's going into the children, right? So they don't feel safe. You know what I'm saying? My students, like, I keep them well informed. We discuss this every day, or for the most part, and they're skeptical. Their parents are skeptical. So just think of the regurgitation of information that they're getting from their parents, and then they're bestowing that on, you know, their peers, and they're walking with this. So for me, I'm always trying to just say, I'm always the beacon of just take the necessary steps, like you said, brother Howard. Just you know, doing the research, educating yourself, informing yourself, and making your own assessment. Right? I think it's essential. You need to do that. However, it's like after that, you still have that hysteria, that fear, that trauma. You know what I mean? So
as a teacher, you have to, you know, you got to recognize that a lot of those kids are really listening to what you have to say. And respectfully, that the fear is there, and I get it, and I respect it as well. I'm a little bit different type of a framework when it comes to most things. I'll go for things. but how you disseminate the information to them is very, very important.
Yeah, I just listen. I don't, I'm never one to try to change the idea of my students. I'm not that type of educator. I'm more or less, I speak to their curiosity and I say, okay, now that's how you feel. Now go do some research about it. I mean, for me though, I'm just more or less hearing them out. But I do feel this though. I think there's a conversation that needs to be had with these parents, especially going back to school. If we're gonna do this whole in-person thing, that's a separate conversation, because if it's going to be a point where they need to be vaccinated, then I think that needs to be a whole separate conversation to get them on that bandwagon of, okay, you know what, let's take this because this is the next step. Because I also see that, I think to Sharice's point, that there might be some people who are reserved and there's going to be a drop off because they don't have access to it. So I just think conversations like that need to be had sooner rather than later, because the way we were ill-equipped for this wave of COVID as far as the educational side was terrible. So if we're going to do this, let's do it the right way. So I'm all for the vaccine, but I mean, it's just different. It's just so nuanced. Like, it's just, once we feel this side is done, okay, what about the educational side? Educational side is done, but what about, this side? So I'm grateful that, with the information you've given, Howard, and also Sharice, is also giving me a lot to think about. But it's just a matter of just being comfortable. You know what I mean?
Now here, let me speak to that. I thought about something, right? Every time I get on an airplane, I say to myself, how the hell does this thing work? How does this work? Like, this is amazing. I'm in a freaking tube going through the air and I'm going to get to where I'm going to go to. How does this work? And I'm scared as shit. And I still get on it. Because the safety is such at a higher rate than driving your own car. And that's just the facts.
Yeah. My dad ain't falling for that shit.
You ain't your dad though. You ain't your dad. You're the next generation. You ain't your dad.
So, I know, but I want my dad to be here. You know what I mean?
Yeah,
so try to get him to,
and that's exactly. So that's another point that you add to your layer of consciousness. Like, I want my dad to be here, but what am I doing? I need to really process this thing.
Yeah, so I feel you.
There's going to be a lot of families divided on this too.
Absolutely.
My husband does not want the vaccine at all. He said if he had a say when he was a child, he wouldn't have gotten himself vaccinated. He would like our future kids not to be vaccinated. He lost that battle.
Oh yeah, I would assume so.
I'm sorry, sir. That's not happening.
Right.
But I will guarantee you that he's not getting the coronavirus vaccine. He's not. I will at some point, but he is not going to do it. And so my extra vigilance and my extra safety, my extra precautions are really more for not just me now, it's for me and him. Because I do want him to be around, right? Like Omar said, you're thinking about not just yourself, thinking about your family. So even though I'm getting it and he's not getting it, I can't be like, well, I'm good, so I'm just gonna do whatever willy-nilly. I still have to be conscious that just because I did doesn't mean, and if I go see my grandmother, she's not gonna get it. My mom is getting hers. She's one of the first ones in line. She's getting hers. My brother's getting his. He's the first one in line to get his. He's not a frontline worker, so it'll take him a while. But he said as soon as they get it to him, he's getting it. So like, I have divided family across the board. And I can't be in a place where I'm like, well, I'm vaccinated and y'all aren't, so I can just be however. I can't do that because I still need to think about the safety of the other people, because you don't know who's going to be vaccinated. We're not going to have a giant sign on our forehead that said, I'm vaccinated. So I'm good without my mask, and then you're good. You're not good with, like, that's not how this is supposed to be. Everybody.
If Bill Gates has his way, we might.
Say it again.
If Bill Gates has his way, we might.
Listen, I heard some crazy stuff about that. Let's not even go down the conspiracy theory thing. But I will say, because you want to make a decision that's the best for you. You also have to think about what's going to be the best for your family unit, regardless of who that is. And if you feel like in your heart of hearts that it's not the best for your family unit, then that's what it is. I know what I do for a living, and I don't ever want to expose my family to that. And that's why I've gotten more strongly on my decision to do the vaccine. So if I'm doing my part on my own end, I feel comfortable in that. And that's the only thing you can ask for. As long as you're comfortable with your decision, that's the end of it. If somebody forces you into this decision, obviously you're not going to feel the same.
Right.
So if you feel comfortable in your decision, I can't say anything to you. I'll give you the information. Whatever you do with it, it's on you.
Right. So for me, I'm gonna feel like this. Once I get it and I'm out in public, I'll follow all the rules, but I'm gonna feel so much more comfortable. It's gonna be like I got my coat of armor. So y'all could go ahead and still be nervous because y'all ain't vaccinated. But I want this shirt with the Superman logo that says vaccinated, because I'm gonna be walking around feeling like I'm good.
And I think there will be a level of comfort. You still wear your mask, but it's like, now if my mask happens to slip when I'm talking, I'm not gonna be freaking out.
Exactly.
I might be a lot less like, oh, you know what? I'll just pull it up, but I'm better than freaking out. I might not have to wear my N95 everywhere I go. I might feel a little bit more comfortable with putting a cute cloth mask instead of this giant bulky green thing covering my whole face.
Right.
So
I want to be able to be in a crowd. I want to be able to walk freely, and knowing that I have that layer of protection. That's just me.
Well, I think like this right here. First of all, one of the things that got me, put fear in me, was because of my blood type. I'm an O blood type, man. You know what they've been saying about O blood types since this thing been going on. And it's like, it's scary as I don't know what, because it's like, if you're O blood, you're less, you won't get it. If you do get it, it's less severe and all this, yada, yada, yada. So I'm like, so what are you trying to say? You want me to come out of the house and just go mingle with everybody? That's the first thing I was thinking, right? But then I was like, someone was saying last week that they said, before you get that vaccination, you have to sign a waiver that you will not sue the company. That's been reported as well too. So I'm like, why would anybody have to sign a waiver for a vaccination? So that's when, just like when you have those different news outlets out there, it just feeds animosity and mental fatigue more so than mental health with this vaccination process.
You have to sign paperwork for all vaccines. I signed one a year when I get my flu vaccine. It's required. I know.
And lastly, it's like the one thing that really gets me too is on the other side of this, you've done so well to come to call to arms to eradicate something that would kill someone in a drop of a dime because it attacks their respiratory system. So, all right, we have other issues that wipe people out just as much as on a yearly basis as well now. I don't know if the numbers are up as far as cancer and different type of illnesses as far as the coronavirus, because coronavirus is still new, but on a yearly basis, you have all these other diseases that wipe great number of the population out. So what are you going to do now? So it's like the spotlight's going to be shined back on the government and on the pharmaceutical companies to say, hey, you got rid of the coronavirus, get rid of this. You see what I'm saying?
I understand what you're saying. I feel like as African Americans, historically, right, we have a very large distrust in our government. And as the years and generations have gone by, we have greater access to information now than we ever did before. Now, the problem, though, with that access of information is the trust that goes along with who and where you're getting your information from, right? So before this point, you can go to your doctor and you would want to wholeheartedly 100% trust your doctor, 100% trust the news, 100% trust your government. So because in our community specifically, there is this great lack of trust between all of those entities that are supposed to know what's right, is really what that leading cause of that fear is that you feel you're being misinformed, being trapped in some kind of way. And as much as I understand that other side of it, there is also the other side of it, right? When you know better, you do better. So yes, there isn't a lot of information out about this vaccine as far as how it's going to affect you specifically. But what is out there for you to have the information on, you still have to make a decision for yourself. You still have to say, let me weigh the pros and cons of this. If I get this, look at your own health as it stands right now. If you have pre-existing conditions, regardless of COVID or not, you're already at a disparity. You know what I mean? Just already. So if you were at 100% in health and you have pre-existing conditions, let's say you're down to 80% in health. And the more those conditions are added upon each other, right? Especially in our community. Then you look at the way in which you live, the way in which you eat, how mobile you are. All of those things are factors, right? And if you put all those things stacked against you already, if something is meant to help you in any way, you also have to put aside everything else that you're feeling and look at the facts in front of you and not put that emotion in front of you. So, Roderick, I understand what you're saying as far as other conditions and other things that are out there. And we are not going to tackle everything at one time. And we can only hope that the same effort will be placed in every single thing, but that's not going to happen. This came out of nowhere and it hit everybody at one time. And that is the reason why everybody jumped on board the way that they did, is because it didn't just affect one area of the world or one specific thing. So everybody jumped on board because it literally knocked everybody out of their boots at one time.
But the thing that we said, trust in the medical field, every time someone says trust in the medical field when it comes to the minority population, it always brings me back to Henrietta Lacks case and how her cells are still being used to this day, and her family is not being compensated at all. They basically on welfare. Yet the minority genome, if you will, goes through so much. I mean, if you think about it, just look at the most recent one when we went through, when we was going through slavery and we was basically being, what's the terminology when you're, I'm from now, it's slipping my mind. Bred, when you was bred, they picked the strongest woman and they picked the strongest man and they bred the two together to make even more efficient slaves, because all they looked at us like cattle. So you got all these different genomes that happen within this little, not little, but in the minority sector, and we still biologically overcame it. But at the same time, it feels like you're like the guinea pig that's always being attacked, and it's like, okay, if it works on them, it's good for us. If it works on them, it's good for us. If it kills them, well, it takes a lot to kill them, because for the most part, they look at us like they're cockroaches sometimes. Then if we don't kill them, it would be strong for us, And that's the one thing that really upsets me,
I understand, but you just, like we said, it is something that you have to treat on an individual basis, not just with this vaccine, just anything in general. You should always look at the information for yourself and really try to take emotions out of it and look at the facts of it. You're right within your feelings. You're well within your feelings. Your feelings are validated. And at the end of the day, we just have to do the best that we can to move forward and not let our emotions drive everything, and look at the facts in front of you and the benefits, and really write it down, like make a list and really do the pros and cons of something and make a decision based on that and not necessarily on emotions.
There have been quite a few Black researchers at the forefront of this vaccine coming to light. All right. So we can look back or we can look forward, because those researchers now that have come to this point are pointing us in the direction of, we're on it now. We're not going to be dictated to. And if we're saying this is good, then I look just like you, I am you, and I have family that looks like you, then I'm not going to mislead myself or them. So there are many, many folks of color that are at the forefront of the research currently. And trust me, brothers and sisters, do the research. It's there, it's positive. That's just my take. Not going to change your mind. I humbly respect your apprehension, but separate the facts from the feelings, and let's make the decision that's best for us individually and us as a community, because it's going to take all of us for us to feel confident moving forward. We can't always live with the victim mentality, or else we'll never get past it. All right. If we continue to just subject ourselves mentally as we were the victim of this, and this, then you're never going to move past that. So that's what we have to separate. And each situation is different. And this is one of those.
I do want to say, don't count it out just yet. Like, don't count it out just yet. Do yourself the due diligence to actually look into more stuff than you're seeing on like CNN and Fox, because there's definitely a lot of information out there, and a lot of it, honestly, I call it doctor speak. It's so complicated. It's so hard to understand. Do yourself the due diligence, sit down and actually look through this information, because they've done the research, and as much as it seems like it's fast for a reason, and we have the ability to get it that fast because of where we are in the 21st century. If we did not get it this fast, it'd have been more disappointing. Like, seriously, what are we doing in the 21st century? Let's get it right. Let's get it right. If they can do something right, I'm happy that this is the one thing they decide to get right, because I'm tired of people dying. I'm tired of it, like sick and tired of it. It's enough. It's enough. Let nature take its course. Let's not just wipe people out just because, like, seriously.
At the end of the day, don't make, I mean, and that, to me, that's the greatest part about this, is I actually thought that it would be mandated. And I'm very, very happy. I feel a lot more comfortable that they're not mandating it. So they're really leaving it up to your choice. So make the best decision for yourself.
They're not mandating it yet.
Yes. Well, you're right. Not as of yet.
That's the caveat. Like, they're not mandating it yet. You know
I agree.
Like, there's this movie out. I think it's with Tiffany Haddish and some white dude. Mm-hmm. And I think they had to like do something. I think get like a shot or something. And he didn't. And then like the people came to his house and you know what I'm saying? So it's one of those things, like, I don't know, art imitates life in some capacity. Like all these movies. Yeah, you know what I'm saying? It's on Hulu. I forgot the name of it. But it's kind of interesting. It's juxtaposed with what we're going through now. It's I
do feel like they will eventually mandate it for essential workers, in school system, and possibly for travel. I do feel like that's going to come up eventually, just because they don't want the same. If they have a solution, right, and people aren't utilizing it, and people are traveling everywhere across the world and doing everything still, then people want to return to some sense of normalcy again, some way in which the world resembled the way it looked before. So I feel like they will eventually mandate it. That's how I feel about it. So it's one of those things where you get it first round up or eventually. But again, regardless of that, you still want to do the research behind it and make the proper decision for yourself, as long as you have the choice to.
Yeah. I mean, one thing too is it's just going to take more than people who are on a different tax bracket than me getting this vaccine. It's going to take more than that for me, because there's a lot more. I feel like the point I was trying to get across earlier with the rest of the panel is just that there's a lot more that Black people have to overcome mentally to want to take a vaccine. So I think that's the underlying issue for me. And I think that's probably why my dad, who's seen it all, you know what I'm saying, he's reserved about it. And it's just hard to really make that assertion, like, people need to take it. And it's like this, people need to take it. I get it. But at the same time, it's like they're not comfortable. And, you know what I'm saying? And there's different things that people are battling mentally and, internally. That's so I don't know. I'm indifferent, honestly, but I am hopeful, if that makes any sense.
Well, that's where I am with it too. I understand both sides, but I'm still indifferent about it as well.
Yeah.
It is that you're absolutely right. It is that trauma that is being faced. There is no long-term study done on it. Like for me, for example, I don't have children as of yet. It's something that I plan to do. And there's no long-term study that is done on this yet where I'm 100% comfortable. I am hopeful, but my level of comfort is not at the level where I'm about to just jump and sign up for it either. So again, it's that trauma of what we face as a people that we're dealing with. And the fact that for me to feel comfortable and safe, I need to know things, and I need to know more than is offered and is available to me right now to know. So.
And last thing, and I forgot to say this too, I just think the fact that we see white folk telling us to take it, we feel uneasy. Like I was watching this thing on CNN, and it was just mainly like, this white dude was just saying like, yeah, it's going to be accessible, but then like towards the latter phases, I think phase 3, it'll be accessible to like the general public, to everyone. So it's I guess how we frame this, the optics, it doesn't look well. It doesn't look hopeful for us. You know what I'm saying? So, but that's it.
And like I said, you're 100% in your right to feel the way you feel and think about it. You know, history has taught us that. So we have to look at all of the information that's being provided to us. I mean, I thank you guys for coming on anyway and for sharing your perspective. I learned some stuff that I didn't know. That's why it's good to have people that's in the field that is, you know, firsthand on there and understand more about what information is being put out there so that they can tell you more about it. Because like we said, a lot of the information is not in our regular lingo, so that you can just say, okay, well, I know what this is and I know what that is and I know what that does. But, you know, all I can say for everyone is really do the research for yourself and make the decision for you.